As I was on the store yesterday, I was getting some milk. So I walked back to the freezer, open the freezer, and have a lot of choices. I can grab the first gallon of milk that I see, or I can go way back in the back and grab the milk that's on the furthest part. Why do you always grab the furthest milk? Because you want the freshest milk. And then I thought, hey, this is a trauma concept. And it has to do with blood in the technician world for the blood bank. So, did you know that the blood bank technician actually is taught and trained to do that? So, when blood is ordered, they get the oldest blood and send it upstairs or to the emergency department to be administered because it's about to expire. We know packed red blood cells last about 42 days. So, if I'm the technician, I'm looking for day 41 blood. So, think about this in trauma. Is older blood just as good in trauma? Well, let's break that myth. Blood banks actually use a term called FIFO. Now, I know all of you guys are thinking, oh, you mean FAFO. Everybody knows what FAFO means. And I guess if you make a mistake, you could have a FAFO, but this is FIFO, first in, first out. So you get the oldest, safest blood first. However, what happens with older blood? Older blood can mean you have less oxygen delivery, there's actually more free iron, and there's a higher risk of complications like infection, immunosuppression. There is some studies that immunosuppression occurs with lower blood, particularly in transplant patients, but also trauma patients too. So the trauma takeaway today is in trauma, speed definitely matters, but so does quality, particularly even in your blood product.